everyone, welcome to my channel. This is Dr. Ananya. In today's video, we'll be talking about cholesterol test. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is this test. Cholesterol is a waxy, fat-like substance that is found in your blood and each cell of the body. You need cholesterol to keep your cells and body healthy. All the cholesterol that is needed is made by the liver. But you can also get some cholesterol from some of the food items such as poultry, fish, meat, and dairy products. Food items that are high in dietary fat can also let liver make more cholesterol. There are mainly two types of cholesterol, LDL and HDL. LDL means low-density lipoprotein, is also known as bad cholesterol. And HDL means high-density lipoprotein, also known as good cholesterol. A cholesterol test is a blood test that measures the amount of each type of cholesterol in your blood. Too much LDL in your blood may cause some serious heart diseases. So, it is important for you to take this test on a regular basis. Now, let us see what is this test used for. If you have high cholesterol levels, you may experience almost no symptoms, but you will be at significant risk of heart diseases. This test helps in measuring LDL, HDL, vldl, total cholesterol, and triglycerides. Now, let us see why you may require this test. Most of the times, this test is done as a part of normal health routine checkup. But if you have a family history of heart diseases or diabetes, you must also take this test. This test is also required by people who have certain risk factors such as smoking heavily, excessive weight, obesity, not enough physical activity, diabetes, or a family history of diabetes and blood pressure issues. Now, let us see how is this test done. For this test, a small sample of blood is withdrawn from the vein of your arm. The sample is then collected and sent to the lab. The results usually come in 3 to 4 days depending on the lab. So, do you need any preparations for this test? For this test, you may need to fast for 9 to 12 hours before taking this test. This is the reason why it is recommended to take this test early in the morning. So, are there any side effects or risks to this test? There are almost no side effects or risks to this test. But make sure the needle is sterilized and the area is well cleaned. Now, let us talk about the results. What do the results mean? Cholesterol is usually measured in milligrams of cholesterol per deciliter of blood. Let's talk about the total cholesterol levels first. For total cholesterol levels, anything below 200 milligrams per deciliter is considered normal. Anything between 200 to 239 is considered as borderline. And anything above 240 milligrams per deciliter is considered high. If we talk about LDL, then anything below 100 is considered normal and optimal. And ranging from 100 to 160 is considered as borderline. Anything above 160 milligrams per deciliter is considered high. Now, let us talk about the range of HDL. If the level of HDL is 60 milligrams per deciliter or anything above this, is it considered very good. And anything below 40 milligrams per deciliter is considered as major risk for heart disease. This high cholesterol can lead to heart diseases. Along with this, your doctor will require additional diagnostic scans or tests to confirm the diagnosis of the disease. After that, he will talk to you to develop a treatment plan that works best for you. So, it's important for you to talk to your doctor or consult your doctor before interpreting your report by yourself and starting or stopping any medication. It is equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.